to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening. I'm Gail Demore, Madam Chair, and here with me are Vice Chair Andrea Sheehan and board members Dr. Ed Weiner and Dr. Marwa El-Sahabi. In addition, we have our professional staff here alongside us, Susan Luminello, Director of Public Health, Michael Green, Associate Director of Public Health, Christine Mathis, our environmental engineer, Marlene Johnson, our RS health agent, and we also have Sandra Troiani, Burlington Public Nurse, with us, as well as our recording secretary, who is online, Julie Falkingham. Thank you for all the work that you do. Please note we are on live and will be taped by BCAT and are available for appropriate comments and questions through this technology. Thank you to BCAT for all that you do to keep this community so well informed. First thing on our agenda are approval of one set of minutes from February 24th. I think we were all present. Thank you, Julie, for making the changes on the letterhead for the designations. I need a motion to approve unless there's questions.
So move, Madam Chairman.
Second.
All in favor?
Aye.
Aye. We have citizens' time. Is anyone here in the room or online that is not part of our agenda that would like to speak to the Board of Health? Anyone in the room? There's quite a few of you. Everyone here is on the agenda? How about online?
So we have one person, Melissa, I'm not sure if she's here for, she's with, okay.
She's with, okay, so everyone's verified as being on the agenda. Great. Chairman's report. Recently, with all the buzz about the upcoming election, I've gotten questions regarding the makeup of the Board of Health. The Burlington Board of Health has been established for about 37 years. There's 5 elected members with staggered terms of 3 years who are voted in by town members and residents. We do currently have a vacancy, which should be filled this April. And alongside the Board of Health elected officials, we have 6 professional staff, 2 administrative professionals, as well as 5 shared services employees through the Tricon grant. We also oversee the volunteers, which I think, are we now up to 250? Around there, around 250 members of our BRC. With that said, we can move into our subcommittee notes. We have 2 tonight, the updates in public health by, is Mara, are you doing this tonight? It's Mara and Dr. Shahabi and Dr. Ed Weiner.
So I had mentioned briefly, I think at a previous subcommittee about blood pressure management, and I just wanted to go into it a little bit more because I just read some updated guidelines that I wanted to share. So, you know, blood pressure, elevated blood pressure is in about 1 in 4 or 5 people. And it really does increase your risk for cardiovascular disease, for chronic kidney disease, for stroke, for dementia. So it's really important that it is under good control. And the key is screening. You know, screening at your doctor's office and then monitoring at home is super important. So the overall goal for adults is less than 130/80 for blood pressure. Again, screening is essential. Sometimes you go into a doctor's office and you have this so-called like white coat hypertension. That's really your body's like basic fight or flight response. And sometimes you may have elevated blood pressures at home, but you go to the office and it's perfectly normal, and so it's not caught, and that's called masked hypertension. So screening is dual, in the office and measuring at home. It used to be that 120/80 was like the gold standard. That's now considered to be elevated. And then stage 1 hypertension begins in the 130s/80s. After that, stage 2 is over equal to 140 over equal to 90. And that's when generally your doctor will probably recommend you to be on some form of a medication. And actually, it is recommended for you to be on, if your doctor does recommend this, it is now recommended to be on a kind of 2 agents in 1 pill kind of combination, because it's easier for compliance, right? To take 1 pill that gives you 2 different drugs that kind of work together synergistically. And the other thing is to always think about lifestyle changes. So the DASH diet is super important. That's dietary approaches to stopping hypertension, lowering your sodium to less than 2,000 milligrams a day, increasing potassium if your physician says that is safe for you. In some patients with kidney disease or who are on medications that cause you to hold on to potassium, that can be dangerous, and reducing alcohol and getting enough exercise. So 2 take-home points: please try and not rely on your smartwatches, because I find that a lot of errors happen. We don't even tend to prefer the wrist bands, for measuring. We like the old-fashioned ones that go on the arm. And also, home monitoring is absolutely key. On an empty bladder, feet planted on the floor. I have patients who have their feet up in bed and they're taking their blood pressure. And the arm should be always at heart level. And that really is the gold recommended standard at this point, that monitoring at home is key and the patient should be very involved in that. So thank you very much for your time.
Great, thank you. The second subcommittee was the Wellness Committee, which our next meeting is this Thursday, in which the group will continue the evaluation of the K through 12 curriculum standards for both health and PE. Moving into our agenda, we have an application for a site plan on 85 Wilmington Road. Who's here for that? Please come on up. Please sign in.
Yep.
And we'll have a background from Christine.
Yep.
Great, thank
Does
you.
anyone want a hard copy of desk size plans before I start, or are we good with,
I'll look at one if you don't mind passing it over.
anyone else?
Actually, may I have one
We
as
can
well?
look together. I looked at it online, but
Oh, you know what? This one's got my markups on it, sorry, I only have one.
It's okay, you take it.
I can pass it. Okay, that's okay. I just wanted to have a better
Dr. Mauer and I,
look at it, and we'll look at it.
I know. Are you going to, it's up on the board. Is
Yeah.
that correct? Good.
So the applicant is the current owner of the existing retail plaza at 85 Wilmington Road. They're seeking to expand the retail footprint of the plaza by adding additional square footage for retail, which will include 2 new buildings. One will be parallel to Wilmington Road and the other parallel to Proudy Road. And the existing buildings will stay. The existing buildings include an L-shaped building with multiple tenants and a standalone, much smaller building that houses a daycare currently, I believe.
Yeah, right, exactly. It's the Rosebud Childcare.
Yep. And the existing stormwater system currently just is comprised of catch basins that flow either into the stormwater collection system in the right-of-way on Wilmington Road or into nearby wetland areas in back of the existing building. The improved stormwater system for the new plaza, or enhanced plaza, will include a large underground infiltration system that will be under the parking lot that will ultimately overflow to both the existing stormwater system in the right-of-way and with limited flow to the neighboring wetlands. From there, I'll let you take over.
Yep. So.
And who are
yeah.
you, please?
Oh, sure. For the record, David Robinson with Allen and Major Associates. My firm are the civil engineers on the project. And yes, as Christine mentioned, we're doing a plaza expansion. We're improving the stormwater out there. We're reducing the phosphorus runoff. We're reducing the runoff to the town's municipal system, reducing the peak rates of flow. We are also proposing 2 1,500-gallon grease trap interceptors for any potential restaurants that may come, and we're aware that there are size limitations on the number of seats that we've backed into the size of the grease traps based on the anticipated number of seats as well as the number of parking spaces that could, reasonably accommodate the restaurants. We did perform test pits for the for the stormwater system. As Christine mentioned, they were witnessed by the Board of Health. The stormwater system is a traditional chamber infiltration system that's designed to reduce the peak flows off-site. We're utilizing 2 water quality units to reduce or to capture sediment on-site and as well as hydrocarbons. And I do not believe that there's any water quality units on site, so we're improving water quality. We're also abandoning an existing pipe that actually flows under the existing building to the north of the site and discharges to a wetland. So we'll be eliminating that pipe and kind of keeping everything contained to a structural system on site, which does overflow into the municipal system under very large storm events, but is designed to infiltrate as needed. We had a number of comments relative to the food service. I touched on the comment 1 was regarding the grease interceptors. Seating may be restricted based on take size once installed. We understand that. We need a separate site plan review with the Board of Health, kind of once we understand which tenants are going to be into the restaurant spaces. We know that we need a 3-compartment sink for any restaurant spaces. Provide adequate space for rubbish and recycling dumpsters. In speaking with the site plan, the planning department, we're planning to increase the size of the dumpsters to bigger dumpsters. They're located currently on concrete pads at the rear of the site and are currently serviced once a week. We're going to be reducing that to bi-weekly pickups by utilizing larger screened dumpsters and consolidating it to 1 dumpster company. Currently, there's 3 dumpster companies serving it to reduce noise at the site, so a little bit more efficient on the dumpster pickup. We need to provide adequate rubbish, recycling, waste oil pickup so as not to cause a nuisance. That kind of plays into that. We got a couple of conditions. I think we're okay with all of the conditions that have been set forth. Condition 1 was about the test pits, which were already witnessed. We understand if this drainage system is to change, move, if we need to add more drainage system, we need to have those witnessed by a Board of Health representative again. We did submit a stormwater and runoff management plan form to the Viewpoint portal earlier today that was signed by the owner, and we understand all the conditions related to septic systems on site. Should we find any? We need to go through the appropriate avenues for that. We're not anticipating any buried tanks or septic systems on site. We understand that we need, during construction, we'll work with our contractor to minimize dust, odor, noise, and any of the other recommendations by the Board of Health. So we really take no exception to any of the conditions. We don't need any waivers for the project, and we will be filing a notice of intent with the Conservation Commission due to the proximity of the wetlands. I believe that was filed either today or will be filed tomorrow. We'll start that process. And we also are on the agenda for a site plan review with the Burlington Planning Board April 16th. We have a town informal meeting with the departments on April the 7th. So I think that's a pretty good summary. At this time, I'd like to open it up to any comments or questions.
Anyone have any questions?
Yes, I do. I'm looking at the underground structure that you are proposing. It's
Sure.
pretty big.
Yes.
What is the maintenance for that structure? And will you be filing, or will you file a maintenance plan with the Board of Health?
Yep, so we did provide an operation and maintenance plan, a section 2.0, under our submitted drainage report for March 4th. The typical maintenance for the chamber systems is it's vacuuming out the sediment from the system itself through the access ports, as well as a lot of these sediment really accumulates in the water quality units that are upstream of the drainage system. So it's vacuuming out those structures as needed. Typically, it's about every 3 years realistically. We did submit an O&M plan that the owner should be following, but it's mostly just physically removing that sediment and any hydrocarbons that are floating in those water quality units.
Madam Chairman, I have another.
Great.
when you mention hydrocarbons.
Sure.
And there are a number of areas where you're going to be collecting water, do they have hoods, or all of the hydrocarbons go into the large receptor, and that's where they are?
They're concentrated in the 2 water quality units. So all of the impervious areas on site, all of the parking lots that would pick up hydrocarbons flow to the water quality units. They're designed to hold those hydrocarbons on the top, and the sediment drops out to the bottom,
Yeah.
and the outlet is sort of in between the two. So it's a very typical, it's called a proprietary hydrodynamic separator. So that's the golden standard for, water quality in a parking lot.
Instead of in every catch basin, they're concentrated.
So it's a good question on the catch basins. We're also proposing our typical design, in most towns required anyways, is to put a hood in the catch basin. So so it's the same idea. It's picking up water from underneath the scum line, but just as a belt and suspenders approach. If in very large storm events, sometimes the hydrocarbons can get under the hood, the water quality unit's going to take care of that.
Excellent. Okay, and is there any mosquito control here that's going to be done, or is that automatic? Do they put the pellets in the catch basins?
I think those are only they do the catch basins in the public ways.
Okay,
I don't think they don't dunk the catch, the mosquito control project doesn't dunk the catch basins on private property.
okay, all right, thank you.
And real quick on the mosquito control, we also speak to that in our O&M report. And one of the things that we look for is for this infiltration system to drain down within 72 hours. That doesn't allow the mosquitoes to breed in standing water. This particular system has a very large footprint, as you noted, and it's sort of due to groundwater on site, it's sort of a vertically shorter system. So it actually drains down in about 10 hours, and those calculations are provided in the DEP standard calcs at the rear appendix of the drainage report that we provided. So it's a good, kind of structural practice for mitigating standing water on site.
One other question, Madam Chair?
Yes.
To our environmental engineer, I'm sure you reviewed the calcs, as I would expect. You always do. Thank you very much.
I just had one question on building number 2.
Absolutely.
Where's the front of the building? Is it on Wilmington Road or is it in the parking lot?
In the parking lot.
Okay.
It's a good question.
Yeah, and then I just wasn't sure.
Right, so, yeah, that would be facing the parking lot because there's going to be landscaping between the building and Wilmington Road.
Okay, that's what I was wondering about as well.
So screen landscaping, we submitted a landscape plan, there's trees planted in the landscape strip
Oh, okay, I see it.
on L101.
Is there anybody
Yeah,
here
trees and shrubs.
from the community?
Were there any, Susan, was something sent out to the butters, like any neighbor?
The
or-
planning board does that.
Oh,
and they-
okay.
Yeah, but we don't.
Okay.
Is there anyone here, a neighbor to the property or anything that wants to speak? No, okay. Any
I
questions?
just have one question or comment. I would assume that this potentially could increase the flow of traffic in that area, and it's a pretty busy intersection between Wilmington Road and Prouty. Do you know if there's any requirements to put in a traffic light, or how are we going to handle the security of the excess?
The increase in traffic from the two buildings by DOT standards for a traffic light is extremely small. You're talking tens of thousands of trips. We weren't even required to do by the planning board, we're not even required to do a traffic impact study. It's a minimal increase, given that it's an existing site. I understand it's busy, but we haven't been required to do a traffic impact analysis, TS study. And we're not anywhere near like a DOT threshold.
Well, there is a daycare there, and there are a lot of kids in that area, especially because they go to Londy's. Is that
Right.
anything we can make a recommendation to, Christine, or have
I mean, we
authority
don't-
to make a recommendation?
We don't typically weigh in on traffic. That, is usually reviewed at the planning board.
Yeah, and as I had mentioned, we are due before the planning board on April 16th. I'm positive it's something that will come up and we can coordinate with the planning board, but the initial assessment from the informal planning discussions are that traffic's not going to be such a concern that it would warrant something like a traffic light at the intersection, especially given that it's an existing developed site and we're not changing the location of the entrances and exits. We're just kind of revising the geometry a little bit just to accommodate our site, but the locations are the same.
Any other questions? Comments? So I'll need a motion to approve the application site plan for 85 Wilmington Road.
So moved. So I just ask, this is a positive recommendation from the Board of Health to the Planning Board, is that correct?
It's to submit the comments, so it's, yeah, with the comments that have
All
been
right.
submitted.
So I move that we approve the site plan with comments to be sent to the Planning Board.
Second.
Seconded by Mara Shahabi. All in favor?
Aye.
Aye.
All set.
Thank
Congratulations.
you very much.
Welcome.
Appreciate the time this evening. Thank you.
Would you like this back?
Sure.
I didn't write on it, I just wanted to look at it on paper.
Did you want to hold on to this?
I was able to, thank you very much.
Okay,
Thank you. Appreciate it.
thank you. Next on our agenda, we have 5 variances. We're starting with Sebastian's at 1 Vandergraaf Drive, unattended food establishment. Please come on up, sign on in, and introduce yourself, and we'll hear an introduction or background from Marlene Johnson.
Hi, I'm Jamie Walker with Sebastian's District Manager.
An unattended food establishment is an operation typically located in office buildings or restricted trade areas where access by the general public is somewhat restricted. These operations frequently offer packaged, time temperature controlled for safety foods and non-time temperature controlled for safety food products that are displayed via refrigeration units, food racks, baskets, and/or countertop display units. Unattended food establishments may also be equipped with microwave ovens or offer automatically dispensed hot and cold beverages. The one common characteristic of these operations is that they lack the presence of an on-site person in charge. Some of these operations are also referred to as micro markets, or referred to as that. So the variance request, Mr. Walker would like to receive Board of Health approval for a variance from 105 Sierra on 9.003 and Food Code Chapter 2, 101.11, which requires the person in charge to be present at the food establishment during all hours of operation. So the same level of protection is provided. The Massachusetts Department of Health Food Protection Program provides the guidance document for unattended food establishments. This was prepared by the Conference of Food Protection. This document was provided to the food establishment noted above and to establish a written food safety plan for the unattended food establishment. I have reviewed and approved the written plan, which is attached. By following procedures outlined in that plan, the same level of protection can be achieved. So tonight, the board may vote yes to approve the unattended food establishment variance for Sebastian's at 1 Vandergraaf Drive with the following conditions. 1, this food establishment shall follow their approved written plan for minimum requirements for an unattended food establishment. 2, this variance is for the location noted above. Any additional proposed unattended food establishments within the town of Burlington will require a separate written plan variance. 3, themselves are appearance before the Board of Health and may result in a temporary suspension of the permit. Continued violations may result in the revocation of the variance by the Board of Health, or in the event of an imminent or threat of a health hazard, the Board of Health may suspend the food permit without a prior hearing as outlined in 105 Sierra 590.014. A 5, food establishment manager shall notify the Burlington Board of Health within 24 hours if there was an imminent health hazard, food tampering, and/or food injury. 6, the Board of Health may revoke, modify, or suspend this variance if, in their opinion, the level of protection is not equivalent to that provided with the strict application of 105 Sierra 590 minimum sanitation standards for food establishments. Or the board may vote no and not approve variance.
Are there any questions?
I guess I have another question. First of all, what's at 1 Van de Graaff Drive?
It's a multi-tenant building.
Office for the most?
Office building, yeah.
Now, I was a little confused. You sent us a picture of a refrigerator, a medium temperature merchandiser, a freezer, and a low temperature merchandiser.
So there's multiple pages.
The multiple,
Yes, so I believe each one is 2 pages. So there's a freezer unit and there's a refrigeration unit.
Just-
And both of them have the capability of shutting off, I'm not shutting off, locking if the temperature rises to a certain threshold.
Okay.
boy, you answered my question.
Yeah, that minus 40 brand of cooler is really nice. They lock automatically.
So if somebody has something in a freezer, how does it, what happens? Do they put money in the freezer and it comes out? Or?
So it's under 24/7 surveillance. So when they walk in the Micro Mart, they're surveilled. They take stuff out of the fridge, and there's a kiosk to order. Everything is scannable. When they scan, it's all cashless.
Okay,
Very good.
interesting.
Yeah.
New world.
Yeah.
Yeah.
It's the way things are going now.
Kind of takes care of itself.
Yep.
Any questions? Any questions? So I would need a motion to approve the variance for Sebastian's at 1 Vandergraaf Drive unattended food establishment.
Motion to approve.
Second.
Second. To include all of the conditions. All in favor?
Aye.
Aye. Great, thank you.
Thank you very much. Thank you for your time.
So our second variance was game show battle rooms at 75 Middlesex Turnpike, external grease inceptor.
It looks like he's online.
He is, and that would be Tyler Jonas.
Dontis.
Dontis.
Thank you.
Thank you.
No problem.
So I'll just give a quick introduction, if I may. So the primary business is entertainment, and the type of food served, the menu is attached. It's a very limited menu. The variance is from the Board of Health's recent receptor regulations, section 2.3 Part A, for the installation of an external recent receptor. The variance application is attached. And the action by the Board of Health, board may vote yes to approve the variance on section 2.3 of Part A and allow the new food establishment to operate without installing an external receipt receptor with the following condition. And since we have 3 others that are coming consecutively, I'll just read this once for all of the folks
Okay.
that are here, just to save some time.
That'd be great.
So the condition is the food service establishment operator and the property owner both understand that the Board of Health may revoke, modify, or suspend this variance if, in their opinion, a level of protection is not equivalent to that provided with a strict application of Burlington Board of Health regulations of 0, which is the least interest requirement for food establishments. The food service establishment shall be notified in writing and given an opportunity to be heard at a regularly scheduled meeting of the Board of Health. Reasons for
Does anyone have any questions?
Yes, I do. For the person online? You understand that you will need to establish and keep up to date a log for the clean out of the interceptor. Grease.
Understood.
And there will be a schedule, and the schedule will be available, correct? I'm going to ask the same question for everybody.
Yep.
Okay. And
Right.
I'm asking this to our health agent. You know, never ask a question you don't know the answer to. They still require to have a food safety manager on staff at all times. You do realize that?
Yes.
That's the certified food protection manager certification.
Certification. Someone has to be there who is certified at all times.
Correct. Yes.
I'm all set.
Any other questions? A motion to approve game show battle rooms, external grease inceptor.
So moved, Madam Chairman, with the conditions.
conditions.
With the conditions as put together by our great health agent.
All in favor?
Aye.
Aye. Great. Thank you.
Thank you.
The next external grease inceptor is Waffles and Bagels at 75 Middlesex Turnpike. Come on down, please sign in, and then introduce yourself. Marlene Johnson will give us the background.
Hi, I'm Tolga Uluchay.
So, Tolga is before you tonight, or is your restaurant going into the Burlington Mall. It's called Waffles and Bagels. And he is requesting a variance from section 2.3 part A, installation of an internal, external grease interceptor. So, the board may vote yes to approve the variance, or the board may vote no not to approve the variance.
Does anyone have any questions?
I just want, same too, I'm going to ask everybody the same question. You're going to keep up the log.
Sorry?
There will be a clean-out log,
Of course.
and it has to be kept up, because when they come in to do the inspection, if it's not kept up to date, you're going to have problems with our health agent and her staff.
So he's referring to the internal grease interceptor, and we require that you have a log on the site. And our local regulations actually require us to issue a $50 fine if you don't have your log, or if your log is not up to date.
Of course.
And the other issue is you do realize in Burlington, you have to have a food safety manager on staff at all times.
Yes, I understand.
No problems.
Any questions?
No, just looking at the menu to see what might be.
Oh, okay.
I'm good, thanks.
So I would need a motion to approve Waffles and Bagels external grease inceptor along with the conditions set forth by Marlene Johnson.
So moved, Madam Chairman.
And second it.
Second by Andrea. All in favor?
Aye.
Aye.
Thank you.
Great, thank you. Cool. And now we've got Happy Life Adult Day Health at 22A Street, external grease inceptor.
12.
Hello, come on down.
Hi. 12 A Street, sorry.
12.
Oh, it's 12. I'm sorry, I put 22. Thank you for that correction. And can you sign in and then introduce yourselves?
Yes, I'm Hetal Joshi and my wife
Java
Java
Joshi.
We're the owners of Happy Life as well as Academy of Creative Arts. Both exist in that building.
Great.
So this is going to be located in the Creative Arts building that's on 12A Street.
Okay.
And his primary business is going to be elderly care, this type of this operation. And the menu is enclosed. So the board may vote yes for the variance or no, not.
Let's start with questions.
I have my first too.
I heard the questions, yes, yes. You already have service manager.
I have a third question, and this is adult daycare, correct?
Yeah.
Does this require any other certifications or licenses from the Commonwealth of Massachusetts?
Yeah, so we have to have the DPH, Department of Public Health license, so we have all the licenses. We can't operate or open operations without all the necessary permits and licenses. So, we have all of those in place and visible. If you come there, they are on a board, notice board, with the dates and everything, because we have, by their requirement, we have to keep all those licenses up to date and visible for everybody to.
And I just have one curious question.
Yeah.
Can people come there for one day or 1 week? How does it work?
Yeah. So it's a 5-day Monday to Friday program. But people can come for 1 day, people can come for half a day, people can come for all 5 days. So we have our vans, we go pick up the seniors, they come here, they do prayers, they do breakfast, they have lunch, they have bingo, ping pong, karaoke, they have fun, and then between 2 and 3, they get dropped back home. In return, we get a lot of blessings. So it's a win-win.
Good, thank you. No, thank you very much. It wasn't part of the purview, except I just was curious for
Yeah.
Yeah.
people are watching.
Yes.
No, you guys are welcome to visit.
Yeah, if you want to enjoy good Indian fun and food,
Well, I'm
very well.
I'm much younger than my colleagues. I'm sure their families may be interested.
No, technically it's called adult day health. So anybody who's 18 plus
Oh, wow.
can come, qualify. Usually 60 plus
Yeah.
people enroll, but we didn't know that until it's like adult day health. Anybody 18 plus, if medically required, needs assistance and things like that, can attend. So everybody young and young are welcome.
Thank you.
Very good.
Awesome.
Madam Chairman, I have a motion to approve the variance for an external grease interceptor waiver for Happy Life Adult Day Health with the conditions as noted by our health agent.
Second.
Second by Andrea, all in favor?
Aye.
Aye.
Madam Chair, may I ask one quick question?
Sure.
And I have one quick question up here. Do you have a dietitian who, I mean, if someone's diabetic or someone?
Yes,
Like,
yeah.
you're able to
That's
provide
also a state
meals?
requirement, yeah.
Yeah.
So in fact, we are the only one in the entire state of Massachusetts where our program director is an actual physician.
Oh, very nice.
So we have a physician on site. I mean, not that, she's there as a
Like a
program director.
geriatrician or?
Yeah, so we have an occupational therapist, we have a dietitian, we have a social worker, we have nurses on staff.
And our activity director is
And our activity director, she's a
physiotherapist.
trained physiotherapist.
Yeah, that's wonderful.
So, yeah,
Congratulations.
That's amazing.
Thank you.
thank you.
Very good.
Awesome.
Thank you.
Thank you very much. Thanks.
All right, so we have another variance, Project Lean Nation, 101 Middlesex Turnpike, Unit 320.
This is the last variance.
This is the last variance. We're going right through 'em.
And this,
Come on down. Please sign in.
Yeah, I was just curious about their business. I was exchanging cards there.
Oh, that's great.
My mom might be interested in being a customer, so.
Oh, that's great. That's great.
I think I have cards, but in the card. I'll
That's
bring-
fine, just
bring
send me
them.
an email, thank you.
So could you please sign in as well and then
Yes.
introduce yourself?
Of course.
And Marlene will give us some background.
So my name is Shweta Jain, and I'm the franchise owner for Project Lean Nation. We are a nutrition store. We plan to open in Burlington in the Staples Plaza. And we are also for the same variance here.
so the menu is also attached. It's basically shakes that they'll be preparing on site, and then they have packaged meals, typically frozen, that people will pre-order that are stored on site. So the board may vote yes to approve the variance, or may vote not to approve the variance.
I just had a quick question. Are you serving the food on site or is it like takeaway?
No, so
Take
it's,
it home?
we are a nutrition retail store. We are not a cafe or a restaurant.
Okay.
So I also got some, just flyers to explain what we do. So what we do one-on-one nutrition coaching for anyone who has either a nutritional challenge, they're looking to achieve a certain health goal, whatever their nutrition journey might be. And, based on their in-body scans, so that tells us their basal metabolic rates, and we set a calorie budget for them, and then we have healthy prepared meals. They're all flash frozen. They all come from our central kitchen in Rochester. So it's a large commercial facility. So there's no cooking in the store. We do have just, nutrition consultants, so to say, and then we work with our clients. We, pack their frozen meal boxes. They typically come once a week to pick up the boxes and check in with their coach, or we can deliver the food. But there's no eating on site.
Okay.
The only fresh food prepared in the store is the protein shakes, and that's the menu that, Marlene has. I've also got some protein ball samples that I would love to hand out if anybody's interested. So they are just, healthy, peanut butter blended with whey protein. They are delicious.
Wow.
So I'm confused. Do they still need a,
They're preparing shakes on site.
and they still will need a,
Yes.
you do understand that?
Yes, so we will have, so what we are proposing is to use an under sink grease interceptor, because we're not cooking anything. All of our shakes, nothing is fatty, nothing is greasy, so we don't expect to have too much, fatty waste. But yes, we do expect to install an under sink grease interceptor.
And you will have to keep logs?
Yes, we will.
You do have on staff, someone there all the time?
Yes.
Who is a food protection manager?
Yes.
Serve safe?
Yes.
Correct. I have no problem. And who's, do you have nutritionists on staff?
So we have nutritionists on staff in our kitchen. So we have chefs and, nutritionists who are preparing the meals. In my store here, I will train my employees. They don't need to be trained dietitians or nutritionists. They just need to be someone who is passionate about health and nutrition. And we have 10 to 20 hours of training depending on their role, which we will provide, and then they can meet with clients.
So one other question, Madam Chair?
Sure.
I'm just curious.
Sure.
Do you have a menu for people who, for instance, are diabetics?
We do not. So I have brought sample menus here. I can.
We have it in front of us.
Well, that's just the shakes. So this is the meals, the prepared meals that we do.
I'd like to see it.
And all of our meals are designed to be 450-ish calories, 30 to 35 grams of protein. They're all designed to be gluten-free, seed oil-free. Oops, sorry. That's the menu for the actual prepared.
Thank you. Thank you.
Yeah, sure. Oops, sorry. I'm running out, so I'm going to hang one on that side. That's okay. Okay, sure. So all the meals are prepared with a 40-30-30 philosophy. So 40% of the calories are from quality carbs, so complex carbohydrates. We don't use any, everything is gluten-free. 30% from protein, and 30% from good fats. So we don't use any seed oils. Everything is just clean, good nutrition that works for anyone, but we don't cater to specific dietary needs as such. We do promote just healthy eating. We call these lifestyle meals because truly it's for anyone. Like my kids love them, And of course, we are not a weight loss company. What we are promoting is balanced eating, right-sized eating, which often results in fat loss. But we are not promoting any fad diets. We are not promoting any miracle cures, none of that. It's just good, clean food.
Do you list the carbohydrates?
Yes, everything is listed.
So the C here is carbohydrates?
Yes, that is correct. So all our meals are macro-balanced in that way.
Okay, good, thank you.
Yeah, for sure.
No problem.
Any other questions? A motion to approve?
I can second that.
All in favor?
Aye.
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 Thank you.
Congratulations, thank you.
Thank you. Samples, anyone?
Sure.
All right.
We might have that for seniors.
Yeah, absolutely. I've got like lots of samples. I would love to. So these these are our protein balls, peanut butter based.
Thank you.
For sure.
Thank you.
So this is what you're trying to report.
You gonna eat it now? What does it smell like? Oh, it smells good.
I like peanut butter.
I do too. Thank you.
So it comes in a pack like that, pack of 6, and each peanut butter ball has 5
those are
grams or more protein, so 5-ish.
They're good.
Very good.
Just clean and good stuff.
Thank you.
Thank you.
Thank you. I wish you luck.
Thank you.
So did we pass it?
We did.
Okay.
Had a snack. Now we're moving on. There were no hearings today, but we have 3 discussions. Shared service update by Isabel Reinert, our health communications specialist.
Yep, and Isabel is online, if you want to introduce yourself, Isabel.
Yes, hi, good evening. Thank you so much for having me. I'm glad to be joining you all tonight to talk about my role and the work I do for the coalition. My name is Isabel Renner, and I joined the Triton back in December as the health communications specialist. I have a background in health communications as well as maternal and child health, and I earned my Master of Public Health degree last year from the Boston University School of Public Health. Next slide, please. Next slide, please.
It's not going.
Since entering into the health communications role, I've completed a few different trainings, including Foundations of Local Public Health, ICS 100, NIM 700, MRC 101, and the Matter of Balance Coach training. Next slide, please. I wanted to briefly overview what I have been working on and the projects I have completed since starting in the communications role. I have been developing the Coalition's annual report for this fiscal year, which includes highlights, key accomplishments, and milestones and data about how many programs we will have conducted by the end of the fiscal year. I've also been preparing the Triton website for public launch, which I will be going into more detail about on my next slide. I also contributed to the development of our coalition flyer and brochure, which were featured at our Civic Expo table, and provided clear information about our mission and available services. I also have been drafting PSAs for the health fair and developed surveys to collect qualitative feedback on staff trainings. This feedback is being used to guide future training selections and ensure they align with staff needs. I also oversee and maintain the shared services coverage and request tracker, coordinating appropriate staff coverage for MAVEN, blood pressure clinics, wellness clinics, Narcan trainings, and other community health initiatives. In February, the Coalition's inaugural staff newsletter was launched and sent out to all to inform them of current Coalition initiatives and activities. This edition featured an overview of our emergency preparedness class, a staff spotlight on new staff, including myself and Brady, and a highlight of Rebecca's work with maternal and child health community partners. It also included a recap of last spring's strategic planning meeting, an overview of Tri-10 programs and staff-supported services, a summary of our participation in the Burlington Civic Expo, and a direct link to the staff calendar on our website, which lists upcoming trainings, programs, and events for staff. Next slide, please. So as I mentioned, I have been helping to prepare the Tri-10 website for public launch, working on different sections. On the home page, I have built out a front page calendar that allows residents to easily access information about our programs and services that we offer, enabling them with the ability to sign up for clinics and classes, including blood pressure clinics and emergency preparedness classes. I've also worked on altering the resources section of the website, which contains detailed information about current initiatives, including emergency preparedness, health insurance for uninsured populations, maternal and child health, stop the bleed, and substance use support. I've built out Rebecca's maternal and child health resources onto the website, so it's broken down by tabs and broken down by town. So we have not only town offerings, but statewide offerings as well, and all the resources are listed there, so they're easier to navigate. Program offerings, our program section on our website is listed with accompanying descriptions and photos. And then as far as accessing the back end of the website, there's a staff login widget towards the bottom right if you're on the homepage of the website, and this is where staff are able to log in and access resources, documents, and the staff calendar, which I mentioned earlier, which includes links to professional trainings and webinars. If you have any complications at all being able to log into the website, please contact me and I would be happy to help you. Next slide, please. Thank you all for your time, and I'd be happy to answer any questions.
Have you all been able to log in on the back end of the website? You should be able to use your civic access passcode to get in. So those resources are specifically for Board of Health staff and Board of Health members in the 3 communities. So we're going to be posting, or Isabel will be posting things on there, resources to be used by staff, trainings and other useful stuff that we have that would just be used by staff or board members.
What about BVRC access for the 3 towns and public access? Will there be any of that?
Yeah, so if you just go to the tritoncoalition.org, it'll bring you to the public-facing side.
Okay, good.
And Purdy's going to talk a little bit about, so Isabel's been building out that website, which we just got last year. So she's been working on putting content on it. And Purdy's been working on one section of the website, which she's going to talk about next. Do you have any questions for Isabel?
Nice job.
I didn't. It was a great presentation. Thank you for doing this.
Thank you.
Thank you very much.
Any questions from anyone else?
Outstanding. Thank you so much.
Thank you.
Great. So we're moving on to our next presentation, Shared Services Update by Pariti Patel.
Yeah.
Welcome.
Susan, do you have my slides up?
Yes. You want to go ahead and introduce yourself and while I bring them up?
Oh, sure. So, hi everyone. I'm so glad to be here and thank you for the opportunity to introduce myself. My name is Pariti Patel and I serve as the epidemiologist for the Triton Coalition. I hold a Doctor of Science in Public Health Epidemiology and Masters of Public Health Epidemiology from University of Massachusetts Lowell. I recently completed my Doctor of Science in August 2025. What drew me to this role at the Triton Coalition Shared Services is the opportunity to work at the community level and have visible impact on people's lives. I was specifically interested in building tools that make public health data more accessible, not just for the professionals, but also for the local leaders, residents, so data can truly support prevention planning and health equity. So my work mostly focuses on data analytics, disease surveillance, and translating the complex public health data into tools that are easy to understand and can be used for the decision making. Next slide, please. So to be able to do my job, I have completed several Massachusetts-specific public health trainings, including Massachusetts Virtual Epidemiologic Network, also known as MAVEN, and the Massachusetts Immunization Information System, are also called MIAS, and I have also completed the Emergency Preparedness Training, ICS 100 and NIMS 100, and in addition to that, I also completed Matter of Balance training. Next slide, please. So, in my role as an epidemiologist, the main responsibility is that I focus on building interactive dashboards, analyzing data, and support disease surveillance using Maven. So at the right side of the screen slide, you can see all the example of the data sources that I have been using. For example, American Community Survey was published by CBC. There are some data analysis tools that are published by Massachusetts Department of Public Health, and then PRFSS data. And in addition to that, I also cross-collaborate with other epidemiologists from other coalitions to know what's going on their shared services. Through Massachusetts Epidemiologists Collaborative weekly meetings. I have done disease surveillance for examples for the mumps, TB, some of the foodborne illnesses. And in addition to that, I'm also currently working on the survey where I will be able to gather some of the information about the community health, not just focusing on the physical and mental health, but as the broader aspect of what community concerns are and what they are looking at when they are thinking of their well-being. And for the dashboards, I will be speaking more about it in the next slide. So can we go to the next slide, please? So one of the major initiatives when I joined back in December 2025 was developing the Triton demographic dashboard. And in addition, I also adapted some of the dashboard that has been already published by Massachusetts Department of Public Health models. So if you go to the Triton website, the first step would be, I'm not sure if...
I'm going to have to stop sharing and reshare to get to...
Okay. Just for the big website. So as Isabel talked about the Triton website, there are different features, and one of the features is called the public health data. So when you do go and select the public health data, you'll be able to access the main page of demographic dashboard. So if you go to the public health data.
Yeah, so here we are on the main page of the tritoncoalition.org, and here's the public health data. I'm going to go to the demographic dashboard section. This is what she's been working on.
Cool.
So once you open this page, you will be able to see the dashboard related information, what it is, what are the features that are included, and how to navigate through the dashboard. If you go a little bit up, Susan, so you'll be able to select between two tabs, the region versus Massachusetts and town versus Massachusetts. And in the town versus Massachusetts, you'll be able to select the town that you are interested in, Burlington, Lexington, or Wilmington, and you'll be able to compare the main statistics between the town and Massachusetts, as well as region and Massachusetts. The highlights are total population, the percent of male and female, and median income. And if you go down, you will also be able to look at the other demographic buttons. So it's race, age, and income. So if you can select age and income, also Susan, that will give them an idea how to go and access the different tabs and buttons. And if you go hover over one of the bars, you will be able to see the percent of population, what is the total count, and you can, of course, compare it with Massachusetts in general. So what this dashboard will answer, it will provide an important answer to the question as, for example, is this population aging in any of the town? Are there any income disparities that you will be able to see? How does the racial and ethnic composition compare to the state or as entire region? So this information is essential for planning programs and allocating resources effectively. Then there is, in addition to demographic dashboard, there is another dashboard that's called Social Vulnerability Index. It's also called the SVI Index. So this has been already established dashboard by the Massachusetts Department of Public Health. So here you can select the town that you're interested to look at, and if you look at the map, it shows the town boundaries and how the different area of the Burlington town shows the different SVI index. If you also select the icon, Suzanne, if you see, yeah. So when you click that, it will pop up a definition of SVI index and what really it entails. It is the tool that combines the multiple factors, including socioeconomic status, household composition, racial and ethnic minority status, housing and transportation, and how this information really helps is it will help us to identify which areas are more vulnerable during the emergencies or public health events or public health crisis. And then there is another dashboard, the respiratory illnesses dashboard. So this is the dashboard. This included the conditions like the COVID-19. For the COVID-19, the Massachusetts Department of Public Health to have information by city and town. So here you could look at the different towns of the Massachusetts, and you can select the town that we are interested in, the year, what are we interested in, and then you could always you can always try to highlight which town you are looking at. If you want to select the Burlington, you could look at the Burlington. You could also select the demographic characteristics that you are interested in. And this data is primarily sourced from the surveillance systems like MAVEN and state level reporting. Then there is also the other aspect of the respiratory illness dashboard that's called the overall respiratory illness overview of the respiratory illnesses, which include all the influenza, RSV, COVID-19, but it has only information for state, not at the town level. And the purpose to put all this dashboard here is like a one source where you could look at the community profile based on health for Burlington, Lexington, and Wilmington. It allows us to monitor trends over time, whether there is an increase during the flu season or there are potential spike in the respiratory illness activity. So it helps us to understand, are there any respiratory specific illnesses increasing in our community? How do these peaks typically occur? And how does our town compare to the state? So this is the brief overview of the dashboard. There are few other features and other data points that are going to be added in the near future. Specifically for the demographic dashboard, we are thinking of adding information related to the education, housing, employment. So that is something that we are looking forward to publish. And then the next slide, that is all I have for here. And in summary, We now have the centralized and accessible public health data tools that community can go and look at and understand what is the community profile and how it compares to the Massachusetts. So that is all. Please, if you have any questions, I'll be happy to answer. Thank you.
That was great. Thank you for the overview. Does anyone have any questions?
I have a question for Director of Public Health. First of all, Dr. Patel, thank you very much for an excellent presentation. You went through a lot of material. Is it possible that you could send us a copy of these presentations?
Oh, sure.
So we could look at them? They're just too good, and they're just filled with information, and I would love to just read through them because they're so good. And thank you for Ms. Renner, too. I appreciate them both, and they're both excellent, but I just like copies.
Yeah.
If you could send those electronically to us. Thank you so much. And I finally understand now what the SV index is, the social vulnerability index.
Thank you.
Great, thank you.
Thank you.
Thank you.
So we're moving and grooving through our agenda here. We got a presentation on the influenza vaccine purchase recommendation by our public health nurse.
Madam Chairman, you may know that my son is a vice president, Jonathan Weiner, of a company that makes and markets vaccines. And since we're going to be discussing the purchase of vaccines, I have traditionally recused myself, and I will leave the room.
Okay.
However, please have somebody come get me when you're done.
Oh, of course.
Thank you so much.
Ready?
Yes, good evening. I am discussing the 2026-2027 flu season vaccine purchase recommendations. The Board of Health bought 250 doses of influenza vaccine on 2025-2026 flu season. Out of those 250 vaccines, we dispensed 244. We will return 6 of those, and we purchased 150 high doses, and we also dispensed 150 of those. The number of total administered vaccinations has decreased over the past 4 flu seasons. Most of those numbers of vaccinations is due to a decrease among those under age 65. The number of high-dose vaccines given to those over 65 of age has remained relatively steady over the last 4 years. So my recommendation is to offer the influenza vaccine to town employees, Burlington residents, or others, because the total number of flu vaccines, regular doses given from 2021 to 2026 had decreased. My recommendation is to purchase 240 doses of pre-filled flu vaccine at approximately $17.84. Also, because the number of high-dose vaccines given has remained relatively steady over the past 4 years, I recommend purchasing 200 doses of high doses, approximately at $66.49 for residents over the age of 65 years. When shipments arrive, I plan to have 1 large-scale flu clinic for Burlington residents under 65 years old, and 3 small-scale flu clinics for over 65 residents, and 3 small-scale flu clinics for first responders and town employees. So the 2026-2027 predictive flu vaccine cost for the standard dose, each dose is going to cost $17.84, which if we buy 240, that will be a cost of $4,281.60. And for the high dose, if we purchase 200, that will cost $66.49 each, which will, the total cost will be $13,298, and the total cost for all the vaccines will be $17,579.60.
Does anyone have any questions?
I just wanted,
I think the numbers make sense. I'm sorry, I didn't mean to cut you
yeah,
off.
no, I just wanted to compare the recommendation to the usage, and it's just going back and forth to the chart and reading, so pardon my delay.
No.
Are you basically saying that we should get about the same as we did last year in both categories?
Well, there was, I think she was saying an increase here from 150 to 200.
That's what she's, okay.
So we increasing the high dose to 200 instead of 150, because we have a higher demand for that one, not so much for the standard dose.
Did we have people come for the high dose and we were out?
Yes.
Yeah,
Okay.
that makes sense.
Yes, that makes sense to me too.
Yeah. Any other questions?
No?
Are we voting to approve the
It's-
increase?
It's just for information only to let you know what's going on with the flu and, you know, what the numbers look like, that type of
Yeah,
thing.
no, I thought it was nicely done. Thank you for the information. I agree with your upping the numbers. I think it's a good idea. Any comments?
Sandy worked really hard last year to get rid of, to dispense out the regular dose. And,
Yes, I remember.
So she wants to get about the same for that. So she thinks she can give it out next year. So we're pretty confident. There still is the reimbursement, correct, Sandy? It's at 20%? or
It's 15%.
15%. So if you don't, so that would be 15% of 240 doses. If you don't dispense that much, then you get reimbursed for that amount.
Okay. That makes
Same thing
sense?
with the high dose, but it's 15% of the 200.
Right,
Yeah.
right.
So if we can, there's some wiggle room there.
Great. Well, thank you for all you do.
You're welcome.
It's great, good information. Moving on to staff reports. Oh, yeah. Leave them in the hallway. He'd be so mad. Thank you. We're ready for you. We're moving on to staff
Thank you.
reports. I have environmental engineer Christine Mathis. Quick overview.
Sure. Household hazardous waste is on May 16th, sorry, at the Francis Wyman School. That's a change from our location over the past 5 or 6 events due to the upcoming construction at Fox Hill. So we'll be at Francis Wyman for at least several events. Again, that's May 16th. I've been working on the hazardous materials storage permit renewals. That's about 110 companies in town that get a permit to store above a certain quantity of hazardous materials. And those are due April 15th.
Wow.
And finally, just last highlight, I've been working with our current intern on preparing radon materials for the health fair. He's doing a update to those programs. Last time that program was updated was probably 8 or 9 years ago. So he's, put in the more recent numbers and gotten new reference, updated reference materials, and produced a brochure, a poster, and a variety of other stuff for a table on radon at the health fair.
Oh, cool.
Any questions?
I did have a question just under your training. What is cyanobacteria?
Cyanobacteria?
Yeah.
So it's a type of algae bloom that forms in water bodies, and it's fairly toxic, can be fairly toxic.
Is it red tide?
Huh?
Red tide?
Yeah, good example is red tide.
Oh, okay.
Which would preclude, like, eating of shellfish and whatnot when there's a red tide, but also you find it in freshwater bodies as well, in the form of like algae blooms.
Okay.
And that's what will cause a lot of times when you have to close a beach. You see,
yeah.
X number of beaches closed
Right.
throughout Massachusetts, and that's usually because of hazardous algae blooms.
Interesting. Thank you. Any other questions?
I have one.
Yes.
10 4th Ave, cracks, vapor barrier.
Yep.
What's going on there?
So that's a restaurant that recently got built, and the restaurant sits above the former buildings 28 and 37 MCP sites. Those are run by Nordblom. And they have an active pump and treat system underneath that site. So the board had them put in a passive vapor barrier system due to the presence of chlorinated hydrocarbons in the groundwater.
And I remember that, but why are you looking at that now? Just to make
Because
sure?
just to make sure they built it.
To make sure they built it. Thank you.
Make sure they installed it. We had one of those that didn't go well.
Yeah, I know.
So, yeah, it went in, and they did an excellent job of documenting it and getting the report and filing with me.
Motion to approve the environmental engineers report?
All in favor?
Aye.
Aye. Thank you. We're now moving on to Health Agent Marlene Johnson.
Good evening.
Hello.
I would like to mention, in my report, you probably noticed, there was a customer's child had an allergic reaction to food.
Yes.
It was not the fault of the restaurant.
Okay.
And that's why I wanted to address the public. On the menus, on the menu boards, you have probably noticed that it says, before placing your order, please inform your server that the person in your party has a food allergy. This is really important, even if you think you're ordering something that may not have an allergen in it. They need to know because they want to make sure that there's no cross-contact with an allergen of somebody else's meal. So I just wanted to state that. And also, I'm working on a couple of presentations for this year. I'm going to do a public presentation that people can register for called Food Safety First, Basic Food Safety Information You Should Know. It's going to be on May 13th, which is a Wednesday from 5:30 to 6:30. The board is invited. We're going to give away some freebies. We have thermometers, we have a nice kitchen companion book, and also a magnet with minimum cooking temperatures. And then the other presentation, Samantha and I are actually working on for the fall, is a food safety forum where we're going to invite certain food establishments who we feel would benefit from a presentation about cooling foods. So when they produce large quantities of food and they have to cool it down, store it, and reheat it. So we're going to provide them with thermometers and some cooling rods. Are there any questions on my report?
Madam Chair, does this also include the Associate Health Inspector's report as part of her report, or does that come under the Director of Public Health?
I believe that's under Susan.
Okay. Can I have just one question? Actually, two. Somebody had an issue with the juice carton, and you said that's not an issue for risk factor, and you've told us that before, but I just want to remind everybody, that's different from baby formula, correct?
Correct. So date marking. So if food is past use by date or sell by date, test by date, that's not going to cost you more dollars. It affects the quality. The only exception is baby formula, baby food, because that has to get nutrients. So the further away from that date marking you go, the less nutrients based part of that product is going to be.
So you can't sell a baby product that's out of date, is that correct?
You shouldn't purchase it if you see it on the shelf, past the use by date. There's a factor of human error. Nobody puts these things on the shelves on purpose, but folks should be looking at dates before they purchase them.
So should the store have take them off after the date? Are they required to?
I haven't seen any that have been past the use by date, so they're really good about that, but yes, they usually do anyway for their own customer satisfaction. Generally, you don't see anything worse than past the sell-by date. But like I said, if you do, it's usually
And then the other question I had has to do with this time of year, we see rodents in certain restaurants. And how often this time of year did you see rodents? I see a couple of times written in the reports. Is that often? And what time? When is the part of the year do we see a lot of rodents?
usually in the fall.
The fall.
Winter comes, yes, but if there's construction going on in the area, that tends to cause them to find new places to go, and if they can get underneath the door, which usually what happens, if they can get underneath the door and then they're in. All of the restaurants have pest control, so as long as they are following the recommendations that their pest control service is telling them to do, then that should eliminate the problem.
Thank you.
I just had a quick question on your, you did a training on Crantom regulations. Can you speak to that quickly and shortly, or?
Did you want to touch on
Yeah,
that, Susan?
You're going to talk about it? Okay, good. All right. I am really, I'm interested. Any other questions? Motion to approve.
Motion approved.
All in favor?
Aye.
Aye. Great, thank you. So next we have supervisory nurse presenting your staff report, please. Do you have a quick overview?
Sure. So the highlights about what I've been working on. So I'm planning and leading the Burlington Community Health Fair that is coming up on April 25th, and it's taking place at the Burlington High School. And besides that, I am also planning and leading a matter balance class that it will start in April 6th, and this takes place at the Board of Health Mondays and Wednesdays for 8 weeks. So this class is for adults that have fear of falling, and so what it does is that boosts their confidence and increase their activity levels. Also, I continue to immunize children by appointment, and I continue to work hand in hand with the Burlington school nurses, making sure that everybody gets immunized.
Good.
Thank you. I have no questions.
Any questions?
I just was curious, how many AED units do we have? Do you know?
5.
Are they?
We have 5. 2 we have at the Board of Health. 1 is at the Ice Palace. The other one is at the Burlington, DPW, but we have also one at the library.
Okay.
Yes.
Any questions?
No.
Motion to approve?
So moved. Madam
Second.
Chair.
All in favor?
Aye.
Aye. Great,
Thank you.
thank you. So then the next thing we've got here is Associate Director of Public Health, Michael Green.
Yeah, Madam Chair. We hosted our annual meeting for the BVRC last Wednesday. I just went over a brief kind of status report, our finances and everything, and then after that, we had a panel discussion that was put on by the Center for Information and Study on Clinical Research Participation in conjunction with Skylight Health, who's done a quarterly meeting for us in the past, and they had a 3-person panel moderated, and they went over, the importance of clinical research and all of their experiences with it. I found it pretty fascinating. There was a lot that I didn't realize about clinical research, and I think the BVRC members present really enjoyed it.
Any questions?
I just had one. I know that you and others in the department took a training on the LSPA Organic Chemistry, Part 1.
Yes.
What is that all about?
That was really kind of an overview of organic chemistry. They covered, the different elements. They actually had a really good periodic table website. I think it was ptable.com.
And who gave this?
I can't remember the professor's name. He's
No, which organization? Why?
Oh, the LSPA, the Licensed Site Professionals Association. Yep.
Okay. Thank you.
Cool. Anything else?
I don't have anything.
All right, good. Everyone's so busy. Thank you. Motion to approve?
Second.
All in favor?
Aye.
Aye. And now we have Director of Public Health, Susan Luminello, to include Associate Health Inspector Samantha Ellsworth's report as well, and shared services.
So I just wanted to report that our budget passed Ways and Means, so we're all set there. The Gail chairperson attended with me, and everything went well. I think we had a minimal amount of questions. We went over the increase in the hazardous waste budget.
Yes.
And that was about it, I think. Not too many questions.
No.
And then the kratom. So I wanted to talk a little bit about the kratom. So that training that we took, myself and Marlene, was put on by Cheryl Sabara of the Massachusetts Association of Health Boards to notify boards of health about kratom and also about the fact that there's model regulations to regulate this substance. What I would like, there's a few boards of health that are already doing this. I'm working right now on a presentation, so I'd like to bring that presentation to the board at our next meeting because there is a lot involved in it. I've put together, it's pretty much done now, but I'm trying to find out how many retailers we currently have in Burlington that stock it. I know there are some. So kratom in its natural form comes from a tree in Southeast Asia, and it's been used in traditional medicine for years. And people drink it in teas or chew the leaves, and it's like a natural, it provides pain relief and it's like an analgesic. The kratom that we have in stores is a synthetic kratom. It comes from the same alkaloids that are present in kratom. However, there is one particular alkaloid that when it goes through the synthetic process becomes more highly concentrated, which causes opioid-like effects. So these products are currently in stores, retail stores, gas stations, convenience stores, those types of places. Some states regulate it, which I'll go through all in my presentation next week. But and the reason why it's being regulated is because they're seeing health effects that are caused from it. Basically, when taken with some other compound. The benzodiazepines compounds, it's been fatal for some people when taking that in combination with this product. So, again, I'd like to bring it to the board next time to go through everything, and then, talk about next steps from there after the board sees like everything that is involved in this.
Okay. Do you think this will lead to a subcommittee?
Yes,
Okay.
I think if the board
Yeah.
wants to move forward, I think that would be the best way to go, because after briefly looking at the model regulations, I think they need a lot. They need work on some areas, because
Good.
they also bring in some different types of substances, which is Delta 8 compounds,
Okay.
which is a derivative from the THC. And then one of them talks about, and any other synthetic type opioid-like compounds or something like that. So I think those are decisions that the board would have to make, like, do you want to stick to just this product? Do you want to bring in other products?
Okay.
And, what part of those regulations do you want to keep? It's some states have gone with just banning the synthetic compounds. However, there's a problem with that, because it's hard to tell the natural kratom products from the synthetic products, because they put natural on them. And they're not FDA approved,
So it's not a food?
no one knows what is it. If it is in food, we do have an ability to regulate it there, because it's not considered an approved food additive. Although most of the things that I'm seeing products that I'm seeing are not food products. They're more like pills and powders and supplements and small energy drink type of products. And I'm trying to figure out now, like, how difficult are these products to find, because they're not always labeled kratom. Sometimes they are, but they're not always labeled that. So
Right.
That's something that I'd like to get the office kind of looking at, working on within the next couple of weeks, now that I've got the presentation for the board pretty much completed, so.
Great. Have you seen Delta, is it Delta 9 or Delta 8?
Delta 8.
Okay.
I know that Samantha has seen it.
Okay.
It was quite a while ago, and we had brought it up to the police because we didn't know if it was,
Right.
enforced by them. It is not. So
Okay.
that is another product that kind of falls into that.
Weird.
Yeah, it's not really allowed, not really regulated type of product.
Right.
Yeah.
Do we
Okay.
have the ability to regulate it?
The kratom? Yes.
We do.
Yes. So other cities and towns are doing it, other states have done
I know
it.
6 states have banned it.
Okay.
Oh, I
think
didn't know
six-
it was that
I
many.
think 6 states.
Okay.
I think 6 states.
Yeah.
And it is being sold in Burlington?
Yes,
It
I know,
is. It's been-
I know it is. Yeah.
Maybe we should have hearings.
I just don't know the extent
Open
of it.
hearing.
I don't know the extent that it's being sold, but I know it's being sold in at least one, maybe two places. And I was going to ask you about possibly bringing it up at the Wellness Committee meeting, just to see if there might be someone there, like working in the schools or with teenagers or children that is familiar with it, might be able to
Right.
give us some more information about what's actually happening in town, if anybody has that type of knowledge. So I thought
Okay,
I
that's a
would
good
try to
idea.
bring it
That
up
is a
there
really
on
good idea.
Thursday.
Yeah.
Sure, it's a good idea.
Yeah. Yeah, I mean, I think this needs to be discussed definitely in detail, and we need to see how we could possibly regulate this.
Yeah. Before this training, I had never heard of it.
Yeah,
I've heard of it, but I don't know much about it.
yeah,
It's an interesting, it can be a stimulant, or it can be sedative, depending on the dosage
Okay.
and how it's being used. And I wasn't sure that it was being sold in Burlington at all. And, but I'd like to look into see if it's where it's being sold in
Yes.
Burlington.
Yeah, so that's what I hope to try to get an idea within the next couple of weeks.
Okay. Any other questions?
Just one question. You had a call from town council and body art?
Yeah, I met with town council on that, so Mike's been looking at those regulations. He's been looking at the body art and the animals regulations, just to kind of clean things up a little bit. So he had a couple questions, I forget actually, can't remember exactly what the question was on, but I brought them up with her, and she kind of cleared it up. Do you remember, Mike, what that was?
I don't. Okay.
So, yeah. So we will, when Mike is finished that, we'll bring those to the board.
Any other questions? Anything about Samantha's report or the shared services report?
Yeah, shared services is continuing with their current work. The nurse has been helping Sandy, or will be helping Sandy, with the matter of balance. They've all been trained as matter of balance coaches, so they're going to fill in that class in April when, if we don't get MRC volunteers to be coaches for that. So they're like a backup.
Motion to approve the Director of Public Health report, which includes the Associate Health Director's report.
Second.
All in favor?
Aye.
Aye. Great. Motion to end our meeting.
Well, before that, maybe we should wish everybody a blessed and happy Easter.
Oh, yes.
And a blessed and happy Passover.
Thank you for reminding me of that. Very good. Motion to approve, or end meeting.
Motion.
Second.
All in favor? Aye. Aye. Okay.